The Future Doctor, exploring AI's potential and controversies in healthcare. As a result of the rise of artificial intelligence doctors, the landscape of healthcare is undergoing a revolutionary upheaval. I am referring to the pretty archetypal image of a robot doctor dressed in a white coat and carrying a stethoscope around its neck that is commonly associated with science fiction. The term AI doctor, on the other hand, has a considerably more nuanced and complex use than that. It is a digital physician that is powered by artificial intelligence AI, and it encompasses a lot more than just the robot that may be seen going around the hallways of a hospital. In the process of diagnosing, treating, and interacting with medical experts, they are redefining medical practices. The scientific aspects of automated healthcare are not the only things that are taking center stage in this exciting new era. The legal consequences of such healthcare are also becoming increasingly intriguing. It came as a complete surprise that the miracle was brought about by artificial intelligence, sometimes known as AI. When the group of medical professionals were presented with a cutting-edge diagnostic system that was powered by artificial intelligence, they were able to experience the transformation firsthand. There was a time that they were captivated by the speed with which the healthcare software analyzed intricate medical records, extracting valuable insights, and predicted patient outcomes with the utmost confidence and accuracy. Their faith and trust in us, a well-known healthcare software development company, gave way to astonishment. Having an understanding of how artificial intelligence is used in diagnostics. Imagine a world in which diseases are recognized in a timely and accurate manner, thereby contributing to the development of treatments that are both efficient and effective. It won't be necessary for you to spend a lot of time imagining. By revolutionizing medical diagnosis, artificial intelligence is turning this vision into a reality. As a result of advances in imaging technology and data analysis, artificial intelligence doctors are getting more adept at diagnosing ailments, which speeds up the diagnosis process. In addition to precisely diagnosing diseases in a patient, artificial intelligence is also capable of promptly placing the disease in the context of the patient's whole medical history. AI makes patient-centered care more effective. During this journey towards better healthcare, artificial intelligence is not merely a silent partner in the background. Rather, it plays an active role in providing care that is centered on the patient. Without a doubt, artificial intelligence AI continues to play a significant part in the field of medicine, particularly in the area of drug discovery. AI made it possible for us to speed up the process of developing new medications by using large amounts of data. Consequently, it is an essential instrument for determining the efficacy of proposed pharmaceuticals. The active role of artificial intelligence, on the other hand, gives patients the ability to take charge of their health. Virtual health assistants and remote monitoring are examples of AI-driven solutions that can improve patient health without the need for professional medical care. Increasing the decisiveness and precision of its decisions is yet another significant step that artificial intelligence takes to improve patient care. Allow me to explain. Every single physician, just like every other specialist, is prone to moments of uncertainty when it comes to the question, what would be the most effective treatment plan for my patient? This results in differences among medical professionals on diagnosis, treatment options, and other related topics. This is where artificial intelligence comes into play. It can make decisions without hesitation regarding the best appropriate course of action by depending on the algorithms that have been built into them from enormous databases. In point of fact, the application of machine learning algorithms to large sets of patient data can make the work of medical AI more objective in comparison to the work of human physicians. Because of this change in the dynamic between the doctor and the patient, legal questions about culpability have arisen. If something goes wrong, who is to blame? Additionally, the act of feeding patient data to AI models poses legal questions regarding the ownership of data and the privacy of medical information. Even though there is still a lot of brainstorming to be done, it seems that the European Association for Artificial Intelligence has run out of ideas in their most recent session. They propose that they give AI robots the status of electronic persons, which would mean that they would be held accountable for any errors in judgment or procedure. Artificial intelligence in developing countries, filling in the blanks in healthcare. Even though artificial intelligence has a favorable impact on healthcare all around the world, its contribution to underdeveloped countries is especially significant. The incorporation of artificial intelligence can overcome obstacles that are associated with limited resources and accessibility issues. As I indicated earlier, artificial intelligence, virtual assistants, and remote monitoring have the potential to make up for these problems by bridging the gap between patients and the necessary medical attention. Assuming that digital education is on par with the capabilities of AI diagnostic tools, it is possible to extend the reach of healthcare services to remote locations. This would improve the outcomes of healthcare. Because of developments in computing power, learning algorithms, and the availability of massive datasets derived from medical records and wearable health monitors, artificial intelligence is poised to play an increasingly significant role in the field of medicine and healthcare. Increasing at a rate of 40%, the market for artificial intelligence in the healthcare industry is anticipated to reach $6.6 billion by the year 2021. Several factors are contributing to the rapid growth of computing power. One of these factors is the widespread availability of graphics processing units, which boosts the speed of parallel processing. Another factor is the availability of virtually endless computing resources on demand in the cloud. Large amounts of data are also well supported by the cloud, which offers virtually limitless storage space. As they interact with training data, learning algorithms are becoming more exact and accurate, which enables them to provide greater insights into diagnostics, treatment alternatives, and patient outcomes. The avalanche of data in the healthcare industry is currently assisting in the development of novel applications of artificial intelligence that have the potential to enhance the effectiveness and efficiency of patient care. Electronic medical records, EMR, and wearable health trackers are two examples of the types of sources that provide access to big data connected to healthcare. This data can be analyzed in a variety of different ways. The evolution of artificial intelligence in the era of big data has the potential to assist medical professionals in enhancing the quality of care they deliver to patients. Additionally, it can equip radiologists with tools that can improve the accuracy and efficiency of diagnosis and treatment. When it comes to handling repetitive job procedures, processing big volumes of data, and providing an additional layer of decision support to reduce the likelihood of errors, artificial intelligence is ideally suited. Frost & Sullivan, a research firm, thinks that artificial intelligence has the potential to enhance patient outcomes by 30 to 40%, while simultaneously cutting treatment costs by as much as 50%. Towards the future of medical care. Artificial intelligence, AI, and medicine are beginning to redefine healthcare. Artificial intelligence is at the vanguard of this development, which is bringing about a revolution in treatment tactics as well as an increase in diagnosis accuracy. It is of the utmost importance to acknowledge that artificial intelligence has the potential to be a potent instrument for advancing medical capabilities. However, it is our responsibility to establish a robust legal framework that guarantees that it will continue to be a tool and will not become a threat to our privacy, integrity, and safety. To ensure that artificial intelligence is responsibly integrated into healthcare, the journey that lies ahead entails the investigation of ethical considerations and joint efforts. There has been a paradigm shift in the entire healthcare ecosystem as a result of the rise of artificial intelligence doctors. This is not only a technological advancement, it is essential to keep in mind that humans are the creators of this so-called artificial intelligence, even though fears regarding artificial intelligence and dystopian scenarios are quite widespread. Because of this, the responsibility for guaranteeing its safety lies with us. So this is the end of our today's video. Do you like it? Kindly give your valuable response in our comment section below, and don't forget to subscribe to our YouTube channel for more interesting and informative videos.